A Look at Health is underwritten with the generous support of Ellis Medicine, reinventing healthcare one patient at a time.
Welcome back, everyone. Well, this week at A Look at Health, we're back at Ellis Medicine, and this is a wonderful series that we're doing. We're talking to doctors in a lot of different modalities and a lot of different specialties to try to get an idea of how you should react to symptoms or things that might be of concern to you, and also to get an insight into kind of the cutting edge of what's going on here at Ellis Medicine. And joining me today is Dr. Abisse, who's a cardiologist. Welcome, doctor.
Thank you.
Very nice to have you here.
Thank you.
Boy, you know what? Cardiology, big topic, and when you get to be my age, a topic that you pay closer attention to. I want to always give the viewers a sense of why you're interested in medicine and why you're interested in cardiology. How come?
So the reason I became interested in medicine was actually started with a story when my father had a minor stroke. And I helped my family navigate the healthcare system while we were here in the United States. And then once I was in medical school, I really became interested in cardiology because it integrates all the systems in our body. And then also from a patient perspective, patients that come with cardiac symptoms come in very sick, and we treat them and we get very quick and appreciable results. And that's where I chose cardiology.
Wow, nicely said, by the way.
Thanks.
In looking at cardiology as a whole, are there segments of the population that might be more in need of paying attention to some of the things on the preventive side? So that's a big question. So first, what groups are more susceptible to cardiac issues?
So traditionally, men are more susceptible to cardiac disease, and especially in once they start hitting the 4th and 5th decade. And they present with typical symptoms, usually chest pain, shortness of breath with exertion. However, there is a subset of patient population, including women, diabetic, and the elderly, that present with very atypical symptoms, including sometimes these patients, they could be having a heart attack, but their symptoms will be similar to having heartburn, shoulder pain, nausea, or sometimes even asymptomatic.
You know, I think we can all relate to this. Men and women operate very differently. If you're a man and you get chest pain, you immediately react to it and whatever. But I've heard this many times, doctor, that women tend to think, because they're caregivers, so they're more concerned about their family. They're more concerned, so they come second. So if they have a pain, they tend to brush it off when they shouldn't, right?
I agree. Yeah. Women should be a little bit more highly attentive to their symptoms, and particularly if their symptoms occur with exertion or they're associated with other symptoms. For example, if a woman is having heartburn but also feel nauseated and sweating, that could be a sign of a major problem than just heartburn.
Yeah, I've got it. You know, again, as you get to be my age, you have friends who go through these situations, and just recently, a very good friend of mine, a woman, just brushed off the fact that she was having trouble breathing when she was hiking. She was perspiring too much and whatever, and sure enough, within a week span, she went in for triple bypass surgery. So you really have to pay attention to it. There are some things you can do, right? I'm thinking of blood pressure, I think cholesterol checks, your body mass index and things like that. What are the things that you should pay attention to?
So if you look, I think that's well said, you know, in terms of for prevention, obesity, high cholesterol, as well as hypertension or high blood pressure are the major risk factors for cardiovascular mortality and morbidity. We should constantly, especially as patients get older, monitor those. And we have certain parameters for blood pressure. Blood pressure should be ranging the normal blood pressure 120/80 to 140/90. Your cholesterol, total cholesterol, should not be more than 200, and your bad cholesterol, LDL cholesterol, should be less than 130. And then also for obesity, your BMI should range anywhere from 18.5 to 25. If you're if your numbers are above those, that's when you should follow up with a physician so that they can modify your risk factors.
And before we went on camera, I was talking to Dr. Abisse about the changes. I had some issues 25 years ago, and it was very interesting how those issues were treated 25 years ago as opposed to today. And you started telling me about the team approach, which is very different than what I saw 25 years ago. Can you explain a bit about what you're doing here at Ellis Medicine regarding that approach?
Yes. So I think there is a national movement in cardiology in particular, but in multiple specialties, to treat patients with multiple physician and multidisciplinary approach. One of the programs that we have at Ellis now is treatment of pulmonary embolism, and we form a team between us, cardiology, interventional cardiology, pulmonary critical care, and cardiothoracic surgery, to come up with a particular plan for each patient. And some of this might include just traditional medicines, but some will lead to interventional procedures that need to be done for those patients.
Got it. That's very different then. And I happen to be talking about an embolism, and back then, 25 years ago, it was, well, you start taking these pills and that was it. But having gone back recently, I've noticed that there is a different approach to that. In terms of cardiology, here at Ellis Medicine, you mentioned that this fall, that, I mean, let's face it, it's constantly evolving, right? And new discoveries and new explorations and things like that. Give us a sense what's kind of on the horizon.
So what's on the horizon here at Ellis Medicine, in one of the programs we're launching, as we talked, is called the PER team, which stands for Pulmonary Embolism Response Team.
Got it.
And that's the team that we just mentioned, where we have multi-specialty involvement to treat patients that come in with acute blood clot into their lung. And then hopefully in the future, slated for the summer of 2017, we're going to have a heart team which deal with structural heart disease, mainly valve blockage like aortic stenosis. And that's, again, a team involving cardiology, interventional cardiology, and cardiothoracic surgery to make a decision for patients what kind of treatment they want.
I've got it. You know, once again, the best medicine is prevention. And if you see any symptoms, you know, we tend to think, oh, I'll be okay and I'll just brush it off. Don't do that. Make it serious. And when you go to the doctor, ask the right questions. You know, I can't tell you the number of times I'll leave and I think, oh, I should have asked that question. And, you know, pay attention to your cholesterol, pay attention to your blood pressure, and pay attention to your body mass, because they all contribute. Right, Doctor, a real pleasure to meet you, and thank you very much.
Thank you for having me.
You're welcome. To see this interview again, you can head to our website, looktvonline.com.